We're gonna hear a breakdown from one of my favorite scammers, the Wellness Way, which is a group of chiropractors that, in my opinion, just lightens everybody's wallets with a bunch of mumbo jumbo. So let's dive into the mumbo jumbo and see how much they confuse you before they use their pen to point out all the stuff on the labs that don't mean anything.
Patient's labs brought to go over that's been struggling with her transition into menopause has really been suffering with more hot flashes, more heart palpitations, and anxiety. On the other flip side, she also has lower depressive states.
Basically, she's struggling with menopausal symptoms. He throws in parasites, candida, and pancreatic inflammation, which if you actually had pancreatitis, you'd know it, and that's a medical disorder. So pancreatic inflammation is nonsense. Parasites with 99% of the population, nonsense. We all have candida, nonsense.
Her libido is really low and she has joint pains and she has no idea why, because her doctors wouldn't test her hormones. She also is complaining of belly, bloating, constipation. She has a history of fibrocystic breast and fibroids, and her blood pressure has been creeping up and staying high, once again, without a plan besides just more medications. Check out what we found with her labs. First,
he's gonna have a plan, which is gonna probably involve a shit ton of supplements that don't work. But let's see what kind of smokescreen he can create with his pen.
First things first, this patient's going to experience more anxiety and heart palpitations because her adrenals are on hyper.
Her adrenals are normal.
Overdrive. Her cortisol is way higher than it should be. But
who says it's normal?
At the same time, she's going to feel sluggish and lower libido because her fountain of youth DHEA is way lower.
Your DHEA level doesn't have anything to do with your libido.
Than it should be. We also found the culprits for a lot of her stress and hormonal issues is because
I want you to notice these circles are yellow, green, and red. Now he's talking about inflammation. He even put inflammation in the first picture, and her inflammation is 0, but he kind of glosses over that.
Because she's barely digesting any of her foods to get the essential nutrients she needs.
Is she pooping? She's digesting.
She's dealing with a chronic inflammatory response from dysbiosis.
What does dysbiosis even mean? He doesn't really talk about that. He just likes to point the pen and circle it. But he doesn't really say what it is because it must be bad.
As well as some infections that we need to clear.
Some infections. Again, not what, but just she's got infections.
Poor pancreatic function was also contributing to disturbances with her blood sugar and sleep and adrenal response, believe it or not, when you have this low of pancreatic enzymes.
So her pancreatic enzymes are affecting her sleep. Basically what he's doing is he's throwing out every possible symptom, because it's like people who do mind reading. If they say, I've got this person whose name starts with T, there's always somebody in there that's gonna say, oh my God, that's my Uncle Tom. He's throwing out every symptom possible because he knows you're going to have at least 1 or 2 of them.
She also has such a loss of beneficial bacteria that are there to protect her unless there's not enough, which there isn't. And
if that's true, then just take a probiotic.
She has all these overgrowths of bacteria like strep and candida and this fungal environment.
Strep and candida are a normal part of your intestinal flora, and they're green, so I don't know what he's talking about.
That's really throwing off her hormonal system further. And on top of that, she doesn't just have one parasitic infection, she has 2 different forms of parasitic infections. This is going to contribute to mental health disturbances, anxiety, heart palpitations, especially. And
I'm curious, did he learn this in chiropractic school? Because I thought they learned about muscles and anatomy and pain and stuff like that. Somehow now he's a parasite expert.
She thought she was doing good eating healthy, but bananas showed up on her list.
These tests have a sensitivity problem, meaning the actual true positive is about 70%, meaning that about 30 to 40% of the people that have the test done have a false true positive, because these tests come up positive if you eat certain foods a lot. So chances are she's not allergic, she just eats a lot of them.
Eggs, chia seeds, hemp seeds, and even tomatoes. So if you don't know what foods are causing you inflammation in the first place, this is the best place to start. So this patient was just ecstatic to be able to work with us virtually. We set up a game plan for her with her nutrition, an herbal regimen that worked really well for her, as she's already seeing results with us just 4 months later.
4 months later, she's seeing results, which in my guess is probably placebo. But he doesn't mention how much money she's had to pay over the last 4 months while she's buying this garbage supplement routine. My guess, because I've seen a lot of patients from this practice, is they're probably paying $700 or $800 a month for supplements that aren't really helping. It's mostly placebo.